Hi, I'm Rumina. I'm a clinical psychologist and I work at the Pickup Clinic at the South London and Maudsley. The Pickup Clinic provides psychological interventions for people with psychosis and bipolar disorder. What I'm going to talk about briefly is continuum models of psychosis. So when we talk about a continuum, we're really thinking about a sliding scale. So if I put my hands up here and think about this as a scale, if we were thinking about height, a lot of us would kind of be somewhere in the middle of a similar or a range of heights. And I guess we'd be thinking about that in terms of the symptoms of psychosis. This could be the normal range, if you like. And then there'll be people potentially at this side who never actually have any unusual experience. And that in itself is quite unusual because we see that these experiences are very common in the general population. And then kind of up this end would be those more unusual experiences that potentially are ongoing and distressing. Every one of us has the potential to experience a mental health difficulty under the right conditions. This idea of mental health conditions being on a continuum is actually not a new one. For many years, we've thought about a continuum between normality and the symptoms of psychosis. Many of us have had an experience where we hear somebody calling our name only to turn around and realise there's nobody there. At the other end of the continuum, there are people who we work with who have ongoing distressing symptoms of psychosis, such as hearing voices. And as a psychologist, we understand these as more severe expressions of traits that are common in the general population. Someone in the middle of the continuum, for example, might be hearing voices, maybe less frequently, and they might not be as distressing. So if we're all on a continuum and we see our mental health on a continuum, it's not clear-cut to say that if you're experiencing symptoms like hearing voices, that you have a mental health problem. We just don't know. What's key is actually not what you're experiencing, but how you're experiencing and the impact of that. I think what continuum models give us is a really good understanding around a range of experiences that all of us have the potential to experience at some point. So if you're someone who's experiencing hearing voices that are distressing, that are interfering with how you live your life, impacting how you function, then it would be worth getting help and support. A lot of the work we do at Pickup is working with our clients to really understand their personalised experiences, to map out exactly what's going on for them, to think about the things that are helping, things that might not be helping, and actually come up with some strategies to help them manage experiences such as hearing voices so they can get back to their life and leading the life they want to live. So try to remember it's not what you're experiencing, but how you're experiencing the impact that's key.